Hey, welcome back, folks, to the Ray Lucia Show, bringing you the best in money information. On set with me today, just timed that out perfect, didn't I? Lyn Rowe, certified financial planner, specialist in long-term health care, but as a CFP, I guess we could take a couple calls together. What do you think? Like the olden days?
Sure.
Back in the day, when you and I
Yes.
were just young whippersnappers in this business.
One of us still is.
I didn't want to talk about you like that. Let's take a call from Rick real quick, and then we'll get to long-term care. Rick out in Phoenix. Hey there, Rick. How you doing?
I'm doing very well, and you?
I'm great. What's up?
I've just got a question on if I was going to do an IRA, a Roth IRA, if I make around $70,000, what would be the cap I could put in for last year's contribution?
How old are you?
I'm 40.
$5,500. Are you married?
No.
$5,500. That's it.
That's all I can do.
Yeah, but you can do one for this year too. So you could put 11,000 in, one for last year, one for this year, as long as you get last year's done by April 15th.
And would you recommend at my age a Roth or a standard?
Well, you're single, making $70K. How much money have you stashed away in pre-tax accounts?
I probably got about 50,000.
You know, you're in the 25% income tax bracket. For me, I'd rather get the deduction. Do you have a pension at work or anything like that?
We got a 401, yeah.
And are you putting any money into the 401k?
I'm maxing that out, yeah.
So how much is in your 401k total?
That's that 50,000.
Yeah, you know what? You're not going to be in a higher bracket when you retire than you are today unless you start saving a boatload more than $5,500. So for me, I would rather you, if you're going to max out your 401k, great. Are you getting a match on 100% of that money or no match?
Match, yes.
So I would put money into the 401k up to the company match, maybe even max it out, and then do the Roth IRA, because in the 25% income tax bracket, and you live in Arizona, add another nickel for state taxes, it's costing you 30 cents on the dollar, and you're not going to be in a combined 30% bracket at retirement, in my humble opinion. So for me, I wouldn't do it. I'd stick with the pre-tax contributions until you max out on that.
Thank you for your help.
All right, buddy. And then take a look at your income and make sure that you can get the deductible IRA. But for me, Lyn, do you agree with me on that?
Absolutely. If he's in the tax bracket that we're talking about, there's no reason not to get that deduction first.
Yeah, because if you think about it, he's making 70 grand. You take 17.5 off of that, you're down in the $57,000 range. He's real close to the 15% bracket, but not quite there yet, unless he's got all kinds of other deductions, mortgage interest, property taxes, and so forth, and then possibly. But the general rule of thumb is if you're in a 15% bracket, the Roth IRA makes sense. If you're in the 25% bracket and you're in a state that also charges state income tax, the deductible contribution's better, because what a lot of people neglect to realize, Lyn, and you know this, is the brackets ratchet up each and every year. So if you're 20 years away from retirement, whereas a married couple today can earn about $90,000 and still stay in the 15% bracket, you may be able to make $140,000 when you retire and stay in the 15% bracket. And last time I checked, even after Social Security, you'd need to have a couple of $1 million in pre-tax accounts before you'd hit that number.
Yep.
Somebody in their 40s with 50 grand stashed away, even investing the max, not going to get to the seven-figure number unless they're a much better investor than you and I.
Indeed. And again, I always go for the tax deductible first, especially if you're single.
Yep.
We single people get nailed.
That's right. You single people do get nailed. Well, I got news for you. Married people get nailed too, but in a different way. Long-term health care.
Yes, let us change
All right,
subjects.
so here's the question that I've had for a long time. There are individual policies.
Right.
And there are group policies.
That's right.
All right, so some people can take advantage of group policies, and sometimes they're a pretty deep discount to the individual ones. Why wouldn't you do a group plan?
Well, there's lots of reasons not to do one, and then there's lots of reasons to do one. If you have group plan available and you do have that kind of a discount and you're single, then oftentimes it makes enormous sense. If you are married, it may not make so much sense because, of course, you get the marital discount. And under those conditions, if you've got that partner discount, it could actually bring your premiums down lower than you could get on the group.
Okay, so what you're saying, though, is that marital discount basically means you
Or
got to buy
partner
one for
discount.
you and one for your partner.
Yep,
So
exactly
you're buying
right.
2 policies. That's why you're getting the discount.
That's exactly right. Then the other issue is not to buy the group if you can get the coverage outside on your own, is the fact that if it's a true group, it's owned by someone else. And you know the story about insurance, if someone else owns it, you don't control it. They can change
It's
it,
not
they can,
portable, I think is what you're saying, right?
well, they can change it, they can stop it, they can do whatever they want. They own the group contract. The certificate is owned by someone else.
People are learning that right now with Obamacare, of
Thank
course. If individuals had their plan that they liked and their doctor that they liked, and their company says, you know what, I'm going to just jettison this policy because it's too expensive to administer, or I think you can get better coverage elsewhere, or I just don't want the hassle, or I'll pay the fine, or whatever the case may be, they cut the plan, and there goes your dental coverage, there goes your long-term care coverage, there goes your health coverage.
Now, of course, you can convert that to, oftentimes you can convert it to a private plan, but it's going to be at your attained age. So if it's 10 years from now and they change their minds and they don't want to have that coverage anymore, you're going to be paying a lot more in 10 years for that coverage.
Okay, so many people, you know, and we talk about this just about every week, so many people are just so concerned about the costs. We heard the president speak last night, and he was talking about these IRA programs for people to put $5 a week, $10 a week, $50 a month away because we have this so-called savings crisis in America, retirement crisis, which we do. But we have a health care crisis that's even worse.
Yes.
Medicare is going broke a lot quicker than Social Security. We're talking about 7 years or so for Medicare. And it's projected that even absent long-term care costs, you're going to spend almost $250,000 in post-retirement health care needs. So this is really a crisis, but most people aren't talking about this crisis.
No, they're not. And unfortunately, I keep coming back to this. The concept of self-insuring is a little, it's very concerning to me because people don't take into account the increased cost every year. We're talking a little over 4% a year on average, compounded, say, for 20 years, thinking that your portfolio is going to grow to cover that, and then not taking into account that you might have other contingencies. What if the kids have problems? Are you going to just say, well, no, I've set that money aside for my health care? Of course not. You're going to help.
Yeah, you know, and I've seen situations, and they're very sad situations, where one person gets sick and the caregiver, usually the spouse, also gets sick.
Yep.
And now where are you?
Yes.
And it becomes a tremendous burden on the
children.
children
It's a huge burden.
and or family members. And as you well know, that has a significant impact on the child's retirement.
Absolutely, because they don't have all of the ways that they can save because they're not working anymore.
All right, give out that number. If you want long-term care, and you should have it, call this lady right here, Lyn Rowe, CFP.
877-270-3127.
877-270-3127, or go to the website iwantmyltc.com. Thank you, Lyn Rowe. Appreciate it.
Thank you, Ray.
Talk to you next week.
Have a great day.
Don't go away, folks. This is The Ray Lucia Show.